Yes, between all of us and our seniors, we decided that if the presentation, which is going to be 40 minutes odd long, and we have a whole spate of questions, then we don't mind going a little beyond the 7 o'clock time schedule.
We are now live on
Okay,
Facebook.
so we can probably take it a little further to 7:15. Isn't that what we said, Mata?
We are now live on
That's fine.
Facebook.
Hello, viewers.
So
Good evening.
I will just update you
Okay.
with the link. Right.
So Shamla, I'm going to be here and I'm going to be going through the whole thing, but I'm just putting myself on mute now.
All right, dear. No issues.
Yeah.
Okay, we've got 6 people already viewing us. 7.
But this is on Facebook
Yes.
or Google Meet.
No, this is on Facebook. On Google Meet, I think we have just one person.
Okay.
We have people coming in now.
All right.
So Shamla,
Yes.
Or Google Meet.
No, this is on Facebook. On Google Meet, I think we have just one person.
Doctor, it's audible enough, right?
Yeah, it is. It is Shamla.
Thank you.
Yeah. Natab, are you presenting something?
Yes.
No, this between all of us and
Currently, it's just going to show the title and
Okay. Okay.
for that, just so that we wait for people to come online.
No problem. No problem. No problem.
yeah, because there are another 5 more minutes to go.
Yeah. Yeah.
So
Okay, we've got 15 people coming on.
all right.
है? हाँ हाँ मैं समझा। हाँ हाँ हाँ
कंफर्म करने से पहले हमें कॉल करेगा।
हाँ
समझ लेंगे और जगह भी कंपेयर कर लेंगे बिल। हाँ
हाँ
सही बात नहीं, अकेले अकेले पी लूंगा।
No, I didn't tailor it. It's still cold. I had to put it in the oven.
तो भी ओके।
Hello, everybody. We'll be starting in 5 minutes. We're just waiting for some more people to join in.
Hello? Yeah, किसका? No, so you don't have to sign in. You just go to the live video and then next to the comment, like suppose you're at yeah, you can just when you say reply no and you start typing, I think you can change. Oh, you can't. Okay, you can't comment for some reason. Maybe you can just go ahead and I guess. Yeah, I guess. Uh, no, it's letting you comment. If someone is like, if you go to Cyrus Patel and type reply, you can. Yeah. That's funny. I'm managing on the like SC responded to anyway. SC already responded to him. And oh, I have another idea. You can also pin. So you can pin all the comments on top. That way it'll be easier for you. Refresh it, doesn't matter. You know, one problem that happened was I can't put both the screens. Like I wanted to put the screen of the I can't put that. Now my live is stuck to the Google Meet, so I'm not moving it from there because I don't want to ruin it. Okay, so we have 2 minutes left. We should start on time. We have like 9 people on this thing, and we don't have many people today. Just 7 people. I think we should write on the group saying please send it to all your contacts. 1 second, I'm just going to write that. 24? I can see only 7. Oh, okay, something's wrong with mine or what? Possible. Yeah, 27 now. Okay, I think the doctor should start now.
Good evening, friends.
Okay, that is fine.
Welcome to this online session of Fridays with Jiyo Parsi. Starting as a community program for the Parsis under the Ministry of Minority Affairs, Jiyo Parsi has become a universal program for creating a work-life balance. Like the Parsis, the world today faces issues of globalization. We all need our voices heard in the unseemingly uncaring silence. We need advice on relationships, loneliness, health, and well being, and above all, psychological, practical, and moral support. The online platform we are offering covers everything from children to culture. As we plan, we look forward to your participation and suggestions. The second online session of our Geoparsi Parzor Forum is a special session. It deals with the delicate balance needed between personal life and the pandemic. Can you try to conceive during this troubled period? What happens if, after years of failed attempts, you had just received the news of your first pregnancy when the world locked down? Will your baby be safe? And what are the precautions you have to take for a visit to your doctor, a necessary ultrasound, or a blood test? These are issues many people face today, and it's not easy for those in the medical profession either. They are dedicated to the welfare of the patient, but what happens when you personally have an elderly parent or children who are depending upon your presence? Do you stop practice if you have a choice? I therefore welcome Dr. Parzan Mistry, who is a consulting obstetrician, gynecologist, and infertility specialist. He has done his Masters of Surgery in Obstetrics and Gynecology from the prestigious Grant Government Medical College and Sir J.J. Group of Hospitals, Mumbai. He has been awarded Diplomate of National Board. He has done his Masters in Reproductive Medicine from London, UK, and has a fellowship in reproductive medicine from the Indian College of Gynaecologists and fellowship in minimal access surgery from World Laparoscopy Hospital, Delhi. He is practicing gynecologist at Bhatia Hospital, Wokhad Hospital, Messina Hospital, St. Elizabeth's Hospital, and Apollo Spectra Hospital, Mumbai. He has authored various publications and chapters in the journals and books pertaining to infertility. Over to you, Dr. Parsi.
Okay. Shamla, am I audible?
Yes, you are, Doctor.
Yes. Are we ready to go, Mahatab? Ritika?
Yes, absolutely. Please go ahead, doctor.
Okay. Can you see the screen? Shamla?
Yes, it is. Yes, it is. Yes, it is, Doctor.
Okay. Okay. So, hi everyone. I'm Dr. Parzan Mistry. And before starting this talk, I would just like to make a disclaimer that we are almost 4 to 5 months in this epidemic, rather pandemic now. And whatever data or whatever talk we'll be giving will be purely based on my personal experience, as well as the data from the index international journals. If you have any complications or problems regarding pregnancy, you're free to contact your gynecologist. Okay, so we're going to start off with the presentation. We are almost now nearing the end of lockdown 4.0, and many of our states are even planning to go into 5.0. We don't know basically where we are heading. But during this time, some people have formed hobbies. Some are doing Netflix and chill. Some are organizing Zoom meetings. Some are playing Ludos on their phones. Some have made their quarantine cooking menus. some have made their quarantine workout plans, and some are just binging on social media. But what I have realized for the past 4 to 5 months, that our life has not been anything less than a Netflix original series. So it started first with the pandemic, where we came to know that there is an existence of a pandemic which is happening around the world. Then came Crown. Now, for all those who don't know, coronavirus derives its name from Crown. So it was 17th November when the third season of Crown came in, and coincidentally, the first case of coronavirus also traces back then. Then came Coronavirus Explained, wherein we came to know a lot about what this virus is, how it is spreading, how it is coming into our community. Then came a season of Money Heist. So be it Tokyo, Denver, Ohio, everyone was caught wearing their masks. But I'm a gynecologist, so I'm going to tap on two important subjects: what to expect when you're expecting, and about babies. Well, William Shakespeare
Excuse me, doctor. Sorry for interrupting, but I believe the video is not on.
Okay.
Sorry,
You cannot see your presentation.
yeah, the presentation. Can you just go to
The
the
presentation can't be seen.
I will help you out with that.
Thank you.
Okay.
Maybe you could just present again, like put the present now.
Can you see it now?
Perfect. Thank you so much.
Okay, so like I said, we ended up with a pandemic. Then we went into Crown, that is coronavirus. Then we came to know about Coronavirus Explained. Then we came into Money Heist, where it got everyone wearing the mask. But what I'm going to tell you is what to expect when you're expecting, and basically something about babies. Well, William Shakespeare has quoted that uneasy lies the head that wears the crown. And past 4 months, we have been really at unease because of this crown in our life. Now, a lot of questions are coming in that is this coronavirus new? So this is the textbook which we generally used to refer during our MBBS times. And this was a Bible then, microbiology and virology. But what you can see is this small paragraph on coronavirus. You know, that was the only data available about coronavirus back then. You know, if people cannot read it, I'm just going to read it out to you. So it was, they're the viruses causing infections ranging from common flu to diarrhea. So that was the only thing what we knew about coronavirus back then. But until 2003, where SARS came into beginning, and that is when we came to know about this virus, and this virus came into limelight. So I'm shutting my presentation now. So basically, we are going to discuss about this COVID-19. Now, what is this COVID-19? CO is corona, VI is virus, and 19 is 2019. So this virus was declared as a public health emergency on January 2020 and became a global pandemic on 11th March 2020. The virus causing this illness is SARS-CoV, basically because it's genetically mimicking the SARS virus, which caused a pandemic way back then in 2003 in Guangdong province of China. So this virus genetically mimics the SARS virus, and that is why the name SARS coronavirus 2. They have also named this virus as novel coronavirus, or the NCOV. There are a whole lot of controversies about how this virus came into being, be it from an animal source, some are saying from the human source, but that is not what we are concerned about. The only thing that concerns us is that there is a frank human-to-human transmission, which we are seeing in the present day, and that is where social distancing comes into play. Now, how this virus spreads? Basically, the virus spreads through one is the direct way, and one is the indirect way. So direct way is when a person having COVID-19 coughs or sneezes onto a person right next to him or her. That is when the person gets coronavirus. Or basically, if someone with COVID-19 coughs or sneezes on his or her hand, and he touches the surfaces, and someone else touches it, and that is how the virus spreads. Lot of times they're coming to know about this magical number 14. So lockdown 2 was 14 days, lockdown 3.0 was 14 days. So what basically is this 14? 14 is basically the incubation period of this virus. That is the time when the virus first enters the body to the time the symptoms start coming in. It is generally seen that by around 11 days, most of the people experience the symptoms of this virus. Questions coming in about one of our near dear ones have got COVID-19. How long do we have to be away from them?
Can I just interrupt for a moment here, please?
Yes, absolutely.
Viewers, can you please put on your captions in case you miss out on some of the things that the doctor is saying?
Okay.
We may be experiencing a little bit of an audio problem. So if you turn on your captions, you'll be good to go. Thank you.
Okay. Am I ready to go, Shamla? Can I continue?
Yes, you are. Yes, you are. Sorry.
Okay. So basically, the virus sheds for around 20 days. So someone near dear one getting COVID-19, maximum of 37 days is what the viral shedding is. So we would generally advise them to stay away for the period of around 40 days. So what are the basic symptoms this coronavirus presents with? So we have symptoms ranging from mild to moderate, which are just like common cold flu, which are like fever around 100°F to sore throat and cough. And in fewer cases, we have severe symptoms like shortness of breath, pneumonia, and decreased oxygen saturation, which will be evident by bluish discoloration of your fingers, tongue, and lips. A lot of our patients are infertility IVF patients. They are generally elderly. So there are non-specific symptoms which are generally seen in such group of patients, which are ranging from body ache, nausea, and diarrhea. So if many of you all have attended last week's seminar of Vinayaka Saukar, and she beautifully explained about how to handle anxiety at home during COVID. There are a lot of questions coming up about, couples staying together, being at loggerheads. There have been increasing divorce rates. But look on the brighter side, there have been almost 2 million births which have been recorded in this present time. So what we are going to do is we are going to divide this basic talk into different categories. The first category will be on the couples planning to conceive. Second category upon the person or couples who are planning to undergo any fertility treatment. The third and the important ones are the pregnant women, be it healthy, be it exposed to corona, or be it corona positive. And in the end, we'll be touching a little bit upon unwanted pregnancies. So what we have seen through our experience is there are some viral diseases which worsen up during pregnancy. What happens is there is a lot of physiological changes which are happening in pregnancy. So be it all the systems of your bodies like the lungs, the heart, the kidneys tend to make certain change to welcome this new guest in the uterus. Secondly, there is a relative immunosuppression in pregnancy. The reason being the baby is 50% of the women and 50% of the partner. So there is a foreign genetic material which is entering the woman's body, and the body has a very strong defense mechanism wherein it tends to reject something which is foreign. So the body naturally tends to lower its immunity to accept this guest, and that is why there is an immunosuppression in pregnancy. Over the past, we have seen a lot of respiratory viruses those are the viruses affecting lungs, causing influenza, SARS, etc. They have had a lot of complications in pregnancy.
I had another
But for all the women who are
he came again,
pregnant
I was
or
still on the
going
call.
to plan
And then
pregnancy
this started.
now, I have
So
got
then I'm
four
like, I'm
good
so
news
sorry
for
to
you.
bet here pe
Good news
Coca-Cola
number
gaya,
one
and then
is
thankfully
pregnant
I
women
didn't
are
want
not
to.
at an increased susceptibility and severity to the disease of coronavirus. Now, what do I mean? Suppose there is a person with coronavirus, and suppose he or she infects, and there is another person woman who is pregnant, and there is another woman who is not pregnant. Both of them have a 50-50% chance of getting the infection. So that means the woman who is pregnant is not at an increased chance of getting the infection of coronavirus. Secondly, even if both of them supposedly tend to get the infection, it's not that the pregnant women will have a lot of complications. Both have got equal chances of developing complications. So number one, good news that there is no increased susceptibility or severity as far as coronavirus is concerned in pregnancy. But saying this, there are certain health issues which pregnant women have to look out for, and they are basically diabetes, blood pressure, asthma, heart disease, kidney diseases, HIVs, patients on certain immunosuppressant medications. These are the people who need to take proper care because these are the ones who are a little bit more susceptible than the general population. So again, going on to good news one, no increased susceptibility, severity, unless you have these high risk factors. Number two, good news. The second good news is there is no increased miscarriages, abortions, defects in your baby, or growth restrictions in your baby. The third good news is there is no increased chances of having intrauterine infections, vertical transmission, transmission through genital fluids, or transmission through breast milk. That means that coronavirus has not been isolated from the amniotic fluid that surrounds your baby. It has not been isolated from placenta, which is a barrier between the mother and the baby. So there is no way coronavirus is going to infect the baby through the blood of the mother. There are no virus which has been isolated from the genital fluids. That means a person suffering from coronavirus or a pregnant woman suffering from coronavirus need not go for a cesarean section. She can opt for a normal delivery. And the good news again is there is no spread through breast milk. So we have 4 good news for all these pregnant women out there. Coming out to the first category of our patients, so the first group of our couples, and this is a question which generally a lot of my friends have been asking me over quite a few days and months rather, that is it a good time to plan pregnancy, and what if I get pregnant, can I continue my pregnancy? So as long as if you're not in the high risk zone of having diabetes, blood pressure, asthma, like I pointed out earlier, again going back to the four good news is that you are not at an increased risk. There are no chances of miscarriage. There is no transmission through genital fluids. It doesn't go through the breast milk. So you're very safe to have a pregnancy. Even if you're pregnant, just a PS, if you're planning your pregnancy this time, make sure that you start off on your folic acid, which are generally available over the counter. A 5 milligram folic acid tablet suffices. If you're planning pregnancy, or you land up with a positive pregnancy test, this is a good time to start your folic acid, and you can contact your gynecologist. Moving on to the second group of our couples, are the couples who are seeking fertility treatment. Now, what happens generally that fertility, infertility is a very huge topic, and if Jiyo Parsi gives me an opportunity, I'll be touching on to these topics later on. But what I want to focus is there are basic 3 fertility treatments which we generally, most of our couples undergo. One is ovulation induction with TIC, wherein the women who are desirous of pregnancy are given certain tablets, medicines, wherein to grow their follicles. And once the follicles are ready, on the basis of the ultrasound, we tell them to keep relations, which increase the chances of pregnancy. The second group of our patients are intrauterine insemination, or an IUI, wherein we give them certain tablets, medicines, injections to grow the number of follicles. And once they are ready, on the basis of sonography, we call the husband, take the sperm, run the sperm in the machine, and the best good quality motile sperms are selected and put into the uterus, which again increases the chances of having a pregnancy. And last but not the least is IVF, wherein we give injections to stimulate the ovaries. And once the follicles are ready, we take them out under anesthesia, take the husband's sperm, fertilize the eggs outside the body in a petri dish in IVF, or we take each sperm and inject inside the egg, which is called as ICSI, intracytoplasmic injection, and thereby transfer the embryos inside, which gives you a good chance of pregnancy. So what are these group of people looking at? So basically, first thing which I need to focus on is information and consent. As far as a lot of our infertility group is concerned, they're basically on the higher age variants. They're mostly about 35 years of age. Many of them have high risk, like I pointed out, like diabetes, blood pressure. Many of these patients coming for the treatment, we used to give them certain medications, solve them out ASAP, and then we used to take them for the treatment. But in this condition, in this scenario, we will be avoiding any high-risk population. Secondly, there might be a high chance that you might have to opt out any time during this treatment if you turn out to be COVID positive. Secondly, what we'll be doing is prioritize our patients. Now, there'll be a fair prioritization. So the patients who are having decreased egg numbers due to certain medical conditions, or they are a little bit at a higher age, or they are cancer patients wherein they have to undergo surgery urgently, we will be collecting the eggs and we'll be giving them a priority as far as fertility treatment are concerned. Thirdly, what we'll be doing is triaging, screening, and testing, wherein we'll be doing regular checkups like tests, screening for healthcare staff as well as our patients. And we'll be taking in the patients who are rather asymptomatic, non-COVID, low risk, or who have recovered, and we'll be opting out people who are symptomatic and COVID positive. What used to happen generally is there used to be a lot of people coming and walking into our clinic during fertility treatment. We used to tell them how it is going to be all about. We used to, on the initial visits, we used to give them certain investigations. They used to come back with the investigations. We used to plan out a fertility treatment. They used to come repeatedly for ultrasounds. But this is what is not going to happen now. There are going to be minimum face-to-face interactions, and there'll be more of teleconsults, which might be happening. Now, IVF comes with its certain complications, something called as hyperstimulation syndrome, wherein when we give the injections to increase the eggs, sometimes the ovaries tend to swell up, and our patients require admission for 2 or 3 days. So we'll make sure that we titrate the doses of injections so that these people don't land up into hospitals, number one. Number two, what we used to do initially in IVF is we used to put in 2 or 3 embryos to increase the chances. But now we'll be putting only 1 embryo so that there are less chances of having twins, so that it's not a high-risk pregnancy and you have minimum visits with your gynae. Healthcare professionals, as usual, will be using PPEs, will be maintaining social distance at the clinics, and there'll be frequent sterilization of the instruments. Coming on to the third category of our patients, and they're the most important, are the patients who are pregnant. So pregnant women have to undergo preparedness. And what is this basic preparedness? One are the antenatal group, are the patients or the women who are actually pregnant. Second is the postnatal care, that is care of the women after pregnancy. Third is the care of the newborn. And fourth, which we generally tend to forget about a lot, is the mental health of the women during this time. Now, going on to the antenatal care is the basic care during the woman is pregnant. Number one, which we need to focus on is hygiene and precaution. Number two is the diet. And number three is the visit to gynecologists. So what are the basic hygiene methods which you need to do is number one, do the 5. What are these 5? 1, stay at home. Number 2, maintain hand hygiene. Number 3, avoid touching face, eyes and nose. Number 4 is maintain social distancing. And number 5, maintain respiratory hygiene. So number 1 is stay at home. Doctor visits will be kept to the minimum. Keep the traffic of home visitors to the minimum. Work from home. Second is hand hygiene. So you can wash your hands with soap for 20 seconds. You can practice singing your baby shark song till the time your babies come out. You can generally use an alcohol-based sanitizer, which you can see over here as a 70%, if you can read it or not. So 70% is alcohol-based sanitizer, which you should generally use. Avoid touching face, eyes, and nose. You might have realized that I'm making deliberate efforts not to touch them. Fourthly is to maintain social distancing of at least 1 meter, and maintain a good respiratory hygiene. Use cloth mask, a 3-layered mask. Avoid coughing and sneezing onto someone, and if you're coughing and sneezing, make sure that you cough and sneeze in a close elbow. So this is what we are looking at. So this is do the 5: hand hygiene, social distancing, stay at home, avoid touching eyes, nose, and mouth, and maintain a good respiratory hygiene. If you are at home, make sure that you keep the shared spaces well ventilated, minimize the time of contact with people, keep minimum of 1 to 2 meters distance, that is at least 3 steps away from the people nearby. Make sure that you use a separate bathroom, separate toiletries. If you're in a same kitchen, make sure that you have your own set of utensils. Use a separate tea towel for drying them. And you should encourage everyone in your household to maintain this hygiene. Now, what we are doing is there is something which is called as shielding, wherein we are protecting a vulnerable group of pregnant women. Now, these are the group of women who are having diabetes, blood pressure, hypertension, asthma, and other high-risk factors. So they need minimum interaction with the outsiders. Family members need to take care of themselves as well as the people surrounding them, and they should have an urgent access to the medical needs. Now, I'm sure that pregnancy is a time where a lot of women tend to they look up to being during pregnancy. The only 2 things which generally women look up to is their marriage and their pregnancy. And a lot of women have planned their baby moon and baby showers this time, but unfortunately, due to this pandemic and unavoidable reasons, you might have to cut them down. Make use of social media, online portal. I've had so many of my friends doing the baby showers over Zoom and other apps, so you can go and do that. What about the diet? There is no special diet which is required as far as coronavirus is concerned. Make sure that there are certain rumors related to diet should be dispelled. Coronavirus doesn't spread through meat, fish, or eggs, so you can very well have your non-veg foods. High protein vitamin micronutrient diet is generally what we are looking at. When you are at basically exposed to an infection, you generally tend to have malnutrition. So make sure that you have a lot of vitamin C and B in your diet. Incorporate a lot of superfoods which are in common parlance, like citrus fruits, ginger, garlic, broccoli, spinach in your diet. The third important thing is visit to the gynecologist. Now, this is something which a lot of pregnant women look up to because this is the time when they see the sonography, they tend to see the baby, they visit the gynecologist, and they feel that everything is going good with them. Now, unfortunately, due to this pandemic, we might have to decrease the visit of these pregnant women to the gynecologist. Initially, we used to have 12 to 14 visits to the gynecologist during the entire course of pregnancy, but now we'll be keeping only minimum 6 face-to-face visits. Now, one thing which I really want to stress on is a lot of pregnant women are scared stepping out of their home due to the virus, but make sure you undergo your routine appointments or antenatal care with your gynac. Please make sure that you attend them because there are a lot of complications which are arising by not going to your gynac than that with the coronavirus. So we have the 4 mandate visits, which are one at 12 weeks, 20 weeks, 28 weeks, and 36 weeks, which you should be looking out for. If a woman has a symptom related to coronavirus, like fever, cough, cold, they can postpone their visits for 7 days. If someone has been in a close contact with a COVID-19 positive, they can isolate themselves for 14 days. Again, the magic number 14 coming to the play. But be rest assured that at least that we'll be seeing you after 3 weeks. Your appointment will not be delayed for more than 21 days. So we will be invariably checking you after 3 weeks. So what are the visits and how to go about when your pregnancy test is positive? Number one is if you are having any high risk factors like diabetes, blood pressure, anything like that. Make sure that you consult your gynecologist because there are high chances that we might have to change the medications because there are certain medications which are not safe in pregnancy. So you might have to switch over to other group of medications which are generally safe. We might have to, there are certain conditions like thyroids wherein the dose need to be stepped up of certain medications, so we might have to do that. A lot of patients complain of spotting at around 4 to 5 weeks, so be rest assured it's called something called as an implantation bleed. So if you have a minor spotting at around 4 to 5 weeks, it is absolutely normal. But if you tend to bleed or it pains, please contact your gynecologist. We routinely do a baseline scan at around 6 to 7 weeks just to see whether the pregnancy is live and and calculate your expected dates and start your folic acid. First mandatory visit, which is going to be at 12 weeks. Now, this is a very important visit because we'll be doing 2 important things. One is the nuchal scan, and secondly, which is the dual markers. So these are the tests which generally give us a basic genetic idea of the baby, and they're almost 98% accurate. So this is a visit which we should not be missing on. The second mandate visit is at around 18 to 20 weeks, wherein the level 2 anomaly scan is done, wherein the baby's structural organs are seen. We give instructions about TT immunizations. We start our patients on iron and calcium. And make sure in this age you consult your gynecologist about registering yourself. Now, it is very important these days because the healthcare facility has been overburdened. So make sure that you talk to your gynecologist and register to the hospital of your choice. The third mandate visit is at around 28 weeks, where we explain the women about the fetal movements. We check the growth of the baby. There are a lot of complications which tend to come up during this time related to pregnancy, rather like diabetes and blood pressure, anemia in pregnancy tend to flare up during during this period. So that is why we need to have this mandate visit. I think the world is going techno savvy. We have a lot of electronic BP apparatus, right? So we can just counsel our patients to monitor the blood pressure at home and give us the readings. The fourth mandate visit is at 36 weeks, where we'll be checking the baby's growth. We'll be looking for any complications and we'll be planning the mode of delivery. So in basics, there'll be a short limit of the visits. The visits will be shortened, they'll be individualized, and most importantly, we'll make sure that everything is done at a single point of time. So all your sonographies, blood tests, and checking with the gynecologist will be done at the same time. If you're suspected with COVID, if you have mild symptoms like fever, cough, cold, don't panic. Contact your doctor. If you have severe symptoms, you need to urgently contact your maternity health services. If you're going to visit your doctor or in hospital, make sure that on the telephone you give a detailed travel history of exposure to anyone with COVID positive. Are you having any symptoms related to COVID positive? Are you coming from a hotspot area? Make sure that you utilize your private transport. If you're booking an ambulance 108, make sure that you report to the staff of the ambulance about your symptoms. We used to see that when a pregnant woman walks into the hospital and there are a bunch of relatives walking in, but we might have to keep minimum people this time. Make sure that you carry your face mask. Once you enter the hospital or a clinic, there will be a thermal screening, which will be done with a thermometer. We'll be assessing the vitals and the pregnancy. If everything is fine, pregnancy is going good, there are no complications, you're vitally stable, you might be sent back to home and asked to quarantine. We might take a swab and send you home. If the swab comes out negative, you can follow your routine antenatal visits. If they come out to be positive, then you might be advised to quarantine and watch out for symptoms. If you are having any severe disease or severe symptoms, we might have to admit you. Now, a lot of questions pouring in about the test for COVID-19. So, who are the candidates who need to undergo the test? Number one are women who are having acute respiratory illness. So, anyone with cough, cold, fever, yes, you're a candidate for having a test done for COVID-19. Secondly, the women who are exposed to COVID positive within 5 to 14 days. Just because someone has coughed next to you, that doesn't mean that you have to rush and go in for your test. It is not an indication for you to go in for a test. If you are going in for a test, you have to be exposed to someone who is reported as COVID positive. And thirdly, are the group of women right now who are awaiting labor or awaiting induction of their pregnancies are having to get their tests done. So most of the gynecologists are generally advising you all to undergo a test post 36 weeks. That is once you touch your 9th month. And the validity of this test depends upon the different hospital policies. Some hospitals take 7 days, some take 14 days as far as the validity of this test is concerned. Now, has allowed the private sectors or private laboratories to undergo these testing from 22nd March, and the price is capped at 4,500. So your COVID test will be done at 4,500 rupees. PCR test is a test which we are generally performing, and the reports come within 48 hours. Now, a lot of questions coming in whether this test is 100% accurate. What if we do the test and if we are COVID negative, are we sure that we are COVID negative? So the answer here is no. So this test has got a false negative rate of 10 to 30%. Now, what do I mean by that? If there are 100 COVID positive women I'm going to test, 10 or 30%, 10 or 30 of these women will be reported as COVID negative in spite of having COVID positive. Now, that is a fallacy of this test, which we are generally facing right now. The only two things the scientists all over the world are currently working on is one is to get accurate tests, secondly is to get the treatment for COVID-19. Now, there are a lot of private laboratories in Mumbai who are doing these tests like SRL, Suburban Metropolis, Thyrocare, a lot of hospitals like HN, Hinduja, Nanavati, and a lot of private labs like Infection and Genetic are come ahead to these tests. If you have any query regarding these tests, you can just call a national helpline, which is 1075, or you can email to the government at ncov2019@gov.in. Thirdly, a lot of patients are asking us that the report is going to take 2 days. So what are we going to do during that time? So we will not be waiting for starting or initiating any treatment based on these tests. Irrespective of your test reports, right now we are treating all patients as COVID positive, and we are basically utilizing all precautions and in our hospital. What to expect basically in labor. Now, there are few studies which are saying that the pregnant women have a little bit of a higher tendency to go into labor early if you're having COVID-19, but there are still studies, there is no any positive response through any of these papers. Now, labor is something which is which a woman will cherish throughout her life, and we have to give a positive experience during labor. We have to make sure that the woman is having a positive experience while she's delivering her baby. This is something which is which will be looking out for her entire life. So we'll be making sure that women all over are getting their positive experiences. We'll be taking care of our infection control policies. There will be obviously testing which will be done. We'll be taking care of your babies. There'll be a clear communication. So if you have any symptoms of labor like pain, bleeding, leaking, please contact your gynecologist urgently. Another question which generally pops out is, are hospitals safe during delivery? Basically, to be very frank, there are very few hospitals which don't have COVID positive cases. But because of there is so much of brunt on the healthcare this time, that most of the private hospitals are having COVID wards. But just be rest assured that the COVID positive patients are treated in a different isolation facility. Even if you're COVID positive, you will be given a separate delivery and an operation theatre from that of a COVID negative mother. Hospitals are taking rigorous infection control practices. All the staff is using PPEs. There are separate staff nurses or separate nurses which are basically allotted to this maternity ward, and they are kept isolated from the rest of the COVID wards. And the staff personnel are also taking good precautions and wearing N95 and etc. Now, a lot of questions coming about birth companion. Will we be allowed a birth companion to be in the labor ward? Now, birth companion, right now it again depends on your hospital at which you are registered, depending upon their policies. They're basically avoided. A lot of hospitals are screening their birth companion, but I think that because of the paucity or scarcity of these tests, there is basically no need to be screening these birth companions. Again, a question saying that what if we are COVID positive? Do we really have to undergo a cesarean section? Like I said, the virus is not isolated from the genital fluids, so there is no role of cesarean section if you are just COVID positive. Yeah, but if you're deteriorating, if your lungs are collapsing, if there is any respiratory distress which is happening, we might have to get the baby out soon, and the only way out is cesarean sections. But that will be purely on the basis of complications related to pregnancy and complications related to your baby inside. Many of women are just nearing their 40 weeks. They don't know whether they have still not landed up in labor. We are testing these women prior to their 40 weeks. We are planning the induction, and we are making sure that the induction to as less. Now, just because of COVID-19, that doesn't mean that we have to just go in and remove the baby out. Timing of delivery is not basically decided on the basis of your COVID-19 status. Question in about spinal and epidural anesthesia. They are completely safe, even if it's COVID positive, negative. There is no issues as far as the epidurals are concerned. So you can very well go in with your epidurals. Gynecologists are giving gases or during the labor to sedate you, or basically for pain relief rather. They are called as entonox. The masks are being changed, and there are single patient filters which are utilized. So don't worry, they are also pretty much safe. Even if you're COVID positive with fever, don't worry, there's not going to be any different form of management. It's just going to be rest, oxygen, paracetamol, and certain antibiotics which you're getting. Now, what when the babies come out? So make sure that you wash your hands before touching the baby. If you're using any breast pump or bottles, don't share them. Avoid coughing or sneezing on the baby. Consider wearing a fluid-resistant surgical mask, or basically this cloth mask on your face while feeding the baby. There is, I've seen a lot of parents. There is a pediatrician right 2 blocks away from me, and I've seen a lot of parents covering their children's mouth with, face shields and masks. Please do not do that. Babies and children less than 2 years of age do not need any masks or do not need any protected shields. They have a danger rather from suffocation. Again, a good news which I told you, breast milk is safe. There is no problem as far as breastfeeding is concerned. So you can very well breastfeed your babies. If the milk is expressed, if you just had a cesarean section, if your baby is in the ICU, if you're expressing the milk, make sure that there is a healthy caregiver who is giving the breast milk. A lot of mummies, sisters, caregivers, japas, maids are going to come to handle your baby, but certain restrictions, no. So if someone who has traveled by air, please do not allow them. If anyone who is having symptoms of COVID, please do not allow them, and keep your babies away from the elderly. There are a lot of children with underlying conditions like asthma, heart disease. These children at a little higher risk of having this infection. So please take care of them. Uh, People are generally tending to keep their newborns with themselves and trying to consult doctors over phone that their newborns are not doing well, they're born yellow. But make sure that these newborns require a face-to-face visit because the pediatrician needs to check about the growth, development, jaundice. So newborns have to be taken to the pediatrician if they call for. As far as milestones are concerned, there are a lot of apps which track the milestones. So at any point of time, you feel that your milestone, your child is lagging behind, or as far as milestones are concerned, you can track the app and consult your gynecologists. Uh, Vaccines, very important. You should not be missing out on your vaccines for your children. For your children less than 2 years of old, vaccines should be given. Coping now, coming to the final part, whereas anxiety is concerned, there is an anxiety associated with virus itself. You open your WhatsApp, you open your phones, and the first thing you see is the graph going up as far as the COVID cases are concerned. The news showing different deaths with COVID. Don't worry, women just dissociate from these news. Okay, try to develop a hobby. Like I said, people are indulging into cooking, they're indulging into painting. So go in for a different hobby. There is an impact on the social isolation, So when you were pregnant before, people used to come in, your friends, your family used to visit. Now, obviously, there is a restriction in mobility. There are various social media platforms, FaceTime, WhatsApp, Facebook. Please go to them. You can share your statuses with your friends. As Vinaifa Saukar said last time about the 7 most key factors for coping against this anxiety is to maintain balance, stop focusing on what if and focus on what is, have a positive dialogue with yourself, have a future focus, relax, stay connected, connect to your inner self. There is just one thing which I really want to tell you is the only way by allowing yourself to, get over this. Take your right hand, put it over your chest, and just say, all is well. Just say these magical 3 words, and I'm sure everything is going to be okay. Touching on basically last to the couples who are not intending pregnancies at this time or going in for abortions. There has been a lot of curb of movement nowadays. So there's been a decreased utilization of contraceptive services. Condoms, contraceptive pills, emergency contraceptives have been less utilized these days. Now it is estimated that almost 25.6 million couples have not got access to their contraception needs. So almost there have been 6.9 lakh sterilizations which we are lacking on. Around 23 million cycles of contraceptive pills which we have not taken into consideration. 9.2 lakh of emergency contraceptives have not been utilized, and almost 405 million condoms have not been utilized. Now, we as Chandrasekhar, who is the CEO of the Foundation of the Reproductive Health Services, has said that the number of births are going to be higher since the active abortion services have been impacted during the lockdown. So many who are having unintended pregnancies may be forced to carry out the pregnancies. So lastly, information and counseling to these couples. Counseling about contraception. You don't need to go to a doctor to have contraception. There are a lot of contraceptive devices available over the counter, like contraceptive pills, condoms. There are a lot of online pharmacies which have opened up. Make sure that you have a proper access to contraception. Many women are taking contraceptive pills. Those are the 21-day pills. You can continue your pills even to 42, 63 days. In that ways, it will provide you protection against pregnancy as well as it will maintain your menstrual hygiene. There are injectable contraceptives which have come into play. So there's a product which is called as Dimpa, which has also been recognized by the Indian Council of Medical Research. just one injection from your local practitioner, and you are safe for 2 months. As far as abortions are concerned, I'm sure you know that a lot of people don't know whether to carry this pregnancy at this point. A lot of people, if they're petrified to carry the pregnancy, then we should reassure that there is no role of abortion just because that it is COVID-19. But if you really want to undergo an abortion or termination, we'll encourage you. Come out as soon as possible, because I had a couple of patients who came to me with a positive pregnancy in lockdown 2.0. They said that doctor will wait for the lockdown to get over. So 2.0 went to 3.0, it went to 4.0. So what happens is generally the abortion services tend to get paralyzed. We have only a certain period of time during which we can abort pregnancies. 81% of the abortions are carried out through medical abortions, or the pills. So by just coming to the hospital and giving pills, it's just single visit. You come, wait for a scan, see the pregnancy is fine, and we give tablets. The patient goes back, and they come back after 15 days. So that is what I really want to talk about. With this, I end with my presentation. The only thing what I want to say is be positive mentally, but not with COVID-19. Thank you.
Thank you very much, Doctor. That was a very in-depth presentation which you gave. And I'm sure many of our viewers are now feeling a little more satisfied, better, happier for having come and heard you.
Absolutely. The four good news.
Yes, the four good news. Basically, we've been having a lot of questions, Doctor.
Absolutely.
But we'll take up only a few of these. And viewers, if you do have any more questions, please keep it as comments. Please keep adding on your comments on the live video. Okay? Yeah, the first question that I would like to bring to you is, Doctor, this was asked by a 5th-month pregnancy woman who said she has fibroids.
Okay.
Is it safe?
Okay.
Any precaution to take?
However, this question is not related to the talk, but I would surely like to take up this question because it's related to pregnancy. Fibroids are very common tumors which we see in pregnancy, rather in all women, for the matter of fact. Main thing is they are not cancer causing. So that's one thing which you should be rest assured. Fibroids tend to cause a lot of problems right from the time you want to start planning pregnancy to the time when you're pregnant. So fibroids might cause problems in the first 3 months, which might, there are a little bit higher chances of miscarriage. But fortunately, you have crossed that barrier, so good news for that. Secondly, you said that you're in the 5th month. The problems which generally the fibroids may cause is one, during your pregnancy. Second, which will be during your labor. And thirdly, will be the problems which will be after labor. So, or after delivery. Now, basically, the problems fibroid causes depends upon two things. One is on the size of the fibroid, and secondly is on the location. So, if your fibroids are less than 3 to 4 centimeters, you don't need to worry about. If your fibroids are there sitting on the head of the uterus, you don't need to worry. But if your fibroid is there somewhere near the cavity where the pregnancy is going to sit, then you have a higher chance of going into early deliveries, or what we call it as preterm deliveries. Normally, the chances of having a preterm delivery is almost 8%, but with fibroids, they do double up to 16%. Fibroids cause something what is called as a red degeneration during pregnancy. So what happens if these fibroids cause degeneration? Don't worry about it. The only treatment is certain painkillers, so it's going to be fine. If your fibroid is sitting near the bladder, it might press on it. You might have little urinary issues. If it is at the back, pressing on your rectum, where your intestines are concerned, it might cause a little constipation. If the fibroid is then near the mouth of your uterus, then maybe you might chance of an obstructed labor, and you might have to undergo a cesarean section. Again, depending upon the size and the location of your fibroid. And these fibroids after delivery tend to do not let the uterus to contract once the baby is out. So there is a chance of a little bit of a more blood loss. But like I said, the fibroids have problems depending upon your size as well as your locations. If there is a small fibroid of 2 to 3 centimeters sitting on the head of the uterus or in the body, you absolutely don't need to worry about. Yeah.
And what would you say after delivery? What is to be done with these fibroids?
Like I said again, the treatment of the fibroid depends upon the size and the location and the complaints which you'll be having after pregnancy. So if after pregnancy you have heavy periods or you have pain, then maybe we might have to deal with the fibroids. It's not necessarily always surgical. We have injections, we have certain tablets which tend to shrink the fibroid. So don't worry about that. But during cesarean section or something, we don't need to take out these fibroids because rather than taking the uterus is full of blood during pregnancy, so we don't tend to take these fibroids out because it tends to cause more blood loss. So don't worry. If the fibroid is small, located one or two, three fibroids located in the body or the head of the uterus, not causing any complaints, forget about it. Yes, but if you're having a lot of blood loss, a lot of pain causing decrease in your hemoglobin levels, then yes, we need to tackle upon this fibroid.
Thank you, doctor.
Yeah.
We have a question from Ms. Kumi Vivena.
Okay.
She asks, is it advisable to go to a hospital during the pandemic for a Shirodka stitch in the 5th month of pregnancy?
Shirodka stitch means that there is going to be a small amount of prolapse which you are having. Depending upon prolapse is a condition wherein the uterus or the gynecologist tend to come down. If this prolapse is causing pregnancy to grow, maybe if you're requiring this surgery in an urgent situation, then you can go in for a Shirotka's sling as if possible. But I don't know whether you're talking about Shirotka's sling or you're talking about Shirotka's patch, because there are two different things, that there are two different surgeries. Slings are generally not performed during pregnancy unless and until there is a big prolapse of the uterus. Basically, we can even take a pessary and shift it up. I think what she wants to say is a circlage wherein the mouth of the uterus starts opening up and we tie the uterus. If that is a condition, then yes, you have to go to your hospital and do a sling surgery because it's a emergency surgery to close the mouth of the uterus. Because if you don't perform this surgery, maybe the cervix will tend to open up and there might be chances that the fluid will leak out early in the pregnancy. So yes, if you are performing a Shirodka circlage, yes, Shirodka sling depending upon your condition of prolapse.
Okay, doctor. We have Jay Patel asking, she's 3 months pregnant.
Okay.
Beta thalassemia trait in parents is harmful to the baby?
Okay, so what happens is that we do something which is called as hemoglobin electrophoresis, wherein we come to know about the thalassemia status of a woman. Now, it depends on whether the woman is also beta thalassemia trait, as we generally do this test for both the partners. So it is going to be done for the women as well as for the husband. So if both of them are positive, then yes, there is a probably 25% chance of having thalassemia in your thalassememia major in your baby. So that is something which we have to look out for. But if your partner is negative, you don't need to worry about. There's only probably just a very less chance of having thalassemia in pregnancy in your baby. If your baby is also thalassemia minor, you don't need to worry about, because many of these babies don't require any blood transfusions or anything like that, and they suffice. Yeah, it's the major bit, or the thalassemia major, which causes more problems. But as far as beta thalassemia minor is concerned, and in one couple, then there is nothing much to worry about. It's just that you have a 25% chance of passing it to your baby, so you just have to look out for it. But again, it depends upon the status of the thalassemia report, both the husband as well as the wife. If one is positive, there are only 25% chance of passing it to your baby. If both are positive, then you just need to observe and look out and do the thalassemia testing of your baby. Inform your gynecologist. More so, inform your pediatrician about the thalassemia, your thalassemia status, because they will take the blood of the baby and test it as far as thalassemia is concerned.
Okay, thank you, doctor. You spoke a lot about COVID-19 and pregnancy. Is there any vaccination to be taken to prevent a form of COVID-19 during pregnancy?
Unfortunately, we are still striving for vaccines and treatment yet. We have still not come out with a treatment. We have still not come out with a vaccine yet. So no, the answer is no. There is no vaccine which can prevent you from getting COVID-19. But there are a lot of other vaccinations which are routinely done during your pregnancy or routinely should be taken in your pregnancy, which you should go in for. Now, generally, tetanus was something which we used to give to our pregnant women before. It's now shifted to Tdap, which we give to our pregnant patients, or it's generally called as Boostrix, which contains tetanus, diphtheria, as well as acellular pertussis component, which is a whooping cough component. So this is a vaccine which generally people take in pregnancy. Women take in pregnancy. Some of them do take influenza vaccines, but all these vaccines are not going to prevent you from getting COVID-19. Even if we come to a consensus, if we get a vaccine, probably we develop a vaccine in the near future, it'll be still some time till we use it in a pregnant woman, because we'll have to do a lot of study and data on this vaccine and the safety concerns in the pregnant women. So yeah, we are still far-sighted as far as vaccine in COVID-19 in pregnancy is concerned.
Okay. But before delivery, what is the validity of the COVID report which the hospital accepts?
Okay. So if you have heard my talk, basically when I spoke about
Yes.
the RT-PCR test, I said that it's totally depending upon the hospital policies. Certain hospitals take a 14-day validity. Certain hospitals take a 7-day validity. Certain hospitals say that as soon as you're admitted, you'll be doing your COVID test. So it totally depends from hospital to hospital. But like I said, that this test is also not 100%. So, there is a lot of false negative. There is 10 to 30% of false negative. So, come what may, we'll be dealing all our patients as COVID positive unless and until proved otherwise. So, the validity of the test will depend upon the hospital which you have registered. But yeah, a fair enough validity between 7 to 14 days is what we are looking for as far as the validity of this test is concerned.
Okay, yes, you did mention about the false negativity of the test.
Yes.
Which come within the 48 hours. What do you do for that?
So the reports come in for 48 hours. False negative is the report, which is so even a COVID positive is reported COVID negative. Unfortunately, we can't do anything about it because that is the fallacy of the test. Like I said, we still don't have a test which is going to give us 100% result. So we have to go with that 10 to 30% of the deficiency as far as the test is concerned. But like I said, we won't be stopping your treatment, or we won't be waiting for your test reports or results to come out to do any intervention or to treat you. So don't worry, even if the test is taking 48 hours, even if you're COVID positive, even if you're COVID negative and thinking you're COVID positive, it is not going to matter to us. We will be treating likewise. Yeah. Hello.
Yes, doctor. Thank you so much. With the absolute important
Shamla,
for the
your
mother.
Voice is breaking.
Sorry, can you hear me? Hello?
Yeah, better now.
I'm sorry. Can you hear me now?
Yeah, much better.
Okay. Yeah. It's absolutely important for the mother to feel safe and secure, and that's why we need to keep telling them about all these things. Now, one of the things that you did mention was that family members have to be away from the child. You should not allow anybody and everybody to touch the child. How long do you expect this situation to prevail?
Well, looking at the current trends, we are still in the midst of a pandemic. We don't know what the pandemic is going to take turn over a few months. Like I said, that we are already near the end of lockdown 4.0. Few of the states might even go into 5.0. So we don't know exactly what is going on in this virus till we don't come to know a specific cure. What has happened over these months is, I'll tell you, Shamla, is we need to set our normalcy. And, I think this is going to be the new normal for us. We will have to, and we might have to live with this virus for quite some time. And like I said, that, living with this virus is not going to hamper our pregnant women from getting care. So as far as obstetrics or maternity services are concerned, we are not going to have any glitches as far as this virus is not going to come in our way. We will be carrying out routine antenatal checkups. We'll be doing necessary sonographies, and we'll be following up the pregnancy very carefully, irrespective of this virus. We don't know how much long will it take. I can't say it's going to take 1 month, 2 months, 1 year. I don't know. But this is the new normalcy which we have set in, and I think we have to tend to assimilate it and accept it. But don't worry, like I said, there's a lot of negativity going on right now. There are a lot of people who are just scared. a lot of people who are bothered. People are listening to the news, new deaths, new cases rising up.
Right.
But like I said in my presentation, that look back, go to your 4 good news. You are pregnant women are not at a higher chance of getting this infection till date. What we have come to know, they are not going to pass this on to your baby, and you are going to get to breastfeed your baby. So it's going to be a pregnancy which is going to go as uneventful, basically, as we were expecting. But yeah, there is going to be a little bit of system changes here and there as far as your hospital staff is concerned, as far as your BP is concerned. You might have to wear a mask during delivery, and there are certain small things which will be happening during this time. But I think that should not allow you to take your mind away from it, because like I said, that pregnancy is something which a woman looks out for in her lifetime, and I think that this virus should not hamper her from doing that.
Okay, doctor. I think we have come to the end of our presentation. Time doesn't allow us any more questions.
Yes.
Viewers,
So, Shamila,
yes.
what I can say is that if there are more questions, and if they have not been included due to the shortage of time, if there are queries, you can surely, the viewers can contact Shamila. They can WhatsApp her the questions, and they can email her also. And I will be getting back with the answers as soon as possible.
Yes, doctor. Thank you so much for
So
all
I think
this.
if you can see the slide, you can just jot down Shamla's number. Shamla, can you confirm
Please.
that your number and
Yes,
your email
the number
correct?
is 9967 7697. I repeat, 9967 7697. Or you can email me at ashamla350@gmail.com.
Okay, so
Yes, you can also visit our Facebook page, Instagram, website, and learn how we can help you. Please feel free to contact us. We'll always be there for you. Thank you so much. Thank you, Dr. Parzan Mistry, for coming on the show.
Thank you for having us. Thank you for having me. I would really like to thank Shamla and the entire team of Jiyo Parsi, Pearl Mistry, Pearl Tirandas, Kritika, Mahatab, everyone behind the scenes, Dr. Shahnaz Kamath. Thank you for giving me this opportunity to be here and to give my peace of mind to you all. Thank you.
Entirely our pleasure, Doctor. Entirely
the
our
pleasure
pleasure.
is all mine. Thank you.
Thank you, Doctor.
Thank you.
Good evening, viewers. Good evening.